Welcome back. Now, as the world continues to battle the ever-evolving COVID-19 pandemic, new variants of the virus are emerging, one of which is the recently identified XEC strain, which has raised concerns due to its potential impact on global public health. Now, the XEC strain variant now, first identified in Australia, is noted for its increased virulence and has reportedly spread to 29 countries, and that's quite alarming. The World Health Organization identifies the XEC strain now as a subvariant of the Omicron lineage of the SARS-CoV-2 virus. This variant now raises concerns regarding its potential for increased transmissibility. Amid this concern, Nigeria's Federal Ministry of Health and Social Welfare has dismissed reports regarding the presence of the COVID-19 variant in the country, urging citizens to ignore misinformation circulating on social media. Now, to strengthen preparedness, the ministry outlined several measures being implemented to safeguard public health, including enhanced surveillance and monitoring across the country and improved healthcare facilities to manage any potential outbreaks. In the same vein, authorities globally are monitoring the variant closely to assess its impact and ensure that public health measures now remain effective. Joining me to discuss this further is the chairman, Chilikon Medical Center, Dr. Phil Njamanze. He joins us from Owerri, the Imo State capital. Doc, thank you very much for coming on the program. This new variant of the COVID-19 virus is said to be quite virulent, and you look at its spread, 29 countries and counting. Should we be really concerned about it here? Because before now, there had been a report that turned out to be fake on social media that the variant is already in the country, prompting the Ministry of Health to put out that reaction.
Yes, that's quite right. The strain has not been dictated by any laboratory in Nigeria as at this time, and the ministry confirmed that. So we can be rest assured that there is no prevalence, but that does not diminish the emergency that we have in terms of having good surveillance. So surveillance must always be there, but even though we have not dictated the strain in any of our laboratories so far, nobody has reported that a documented case. So to that extent, yeah, I think we have to not be too worried that the strain is here. The problem we have with these pandemics is that it creates a lot of chaos and a lot of fear and anxiety in the society that is actually not warranted. Because when we look at disease prevalence, we are looking at mortality, we are looking at morbidity. And this is what defines the severity of the disease. It's not because it's even virulent, because we have common cold almost all through yearly, and they are even more virulent in terms of and contagious than in the COVID variant. So we can only at this time say, yes, we are particularly with heightened surveillance. And that's the correct attitude we need to have, and make sure that the reported cases are properly investigated, screened in laboratories, and then if we should find this strain, have the appropriate preparedness for this. I think Nigeria came out very well in the last pandemic, and I have no fears that we will do that. The doctors, both in the private and public sector, are very much aware of this XEC, and they are keeping vigilant. And if any person was to show up in any of the public or private hospitals, I think the person will be screened for this.
You know, for a lot of people had thought, and that's the impression that they still have, that, you know, we were done with COVID-19, so to speak, especially in this country. But, you know, we've continued to have variants upon variants. What exactly is going on? Is this a case of mutation, or what's responsible for these variants we're having? And it appears there's no end to it. We've had Omicron, we've had other variants, and now we have the XEC variant.
Yes, but this is actually the nature of viral infection because there is constant mutation. There's no way of stopping that natural process. The question is, though these mutations occur, but most of them don't go on to spread and become a very important, virulent virus. But we know that this will happen. We have multiple mutations, even of the common cold virus, every season. Though nobody announces it and gives them a name, but this occurs regularly. So it's of little concern that we are having these variants. But the good thing is the force of this virus is weakening compared to what happened 2 years ago, and now there's a very clear difference. So we are getting to the point of saturation, I would say, both natural saturation and the familiarity and education of the public. The common steps people take: good personal hygiene, covering your mouth when you cough, or having a bent elbow, using sanitizers, face masks, physical distancing, vigilance, and then getting tested in a hospital or a public health institution of any kind. So this is all ongoing, and people are very much aware of this. And the campaign and public education, as your station is doing, is very welcome so that people will be aware. Because the most important thing is to prevent a public panic. Because panic really does not do anything for preparedness. It only heightens anxiety and actually throws off the health system. We really have major health emergencies: malaria, diarrheal diseases. We have heart diseases. Diabetes is almost on a pandemic level. So these are more important because when you look at their morbidity and mortality, it's very high. These diseases, for all is what, including the COVID-19 variants, are not really particularly important when it comes to morbidity and mortality. So I think we really need to re-educate the public about this and allay fears. And I think the ministry's message is correct.
Now, if this variant has spread to 29 countries, that's at the last count, because there's a possibility it's actually gone beyond that number. Some people would argue that it's only a matter of time then before it gets to Nigeria, considering the way Nigerians travel. I mean, you have Nigerians virtually everywhere on earth. And so some people would argue it just might be a matter of time before, it gets to this point. I mean, it gets to this part of the world. Is that a concern that you have?
Yes, of course, Nigerians are everywhere, as you rightly pointed out, and they are flying in and flying out. So we should expect and be prepared that we will also get this variant. The most important thing in this is that we know it's coming. If we can dictate where it's coming from, and we do the needful actions to isolate those people and get them treated. This is very, very important. The most important aspect of all our vigilance is the testing that takes place in hospitals, in the private sector, and in the public sector, and having all these testing centers. I think by now, and what should be done by the Ministry of Health, is by now that you should also have testing centers to the ward level, because if there's one thing good about the whole pandemic series, is that this tells us that all healthcare is local. That means what is very important in dealing with any disease outbreak is how prepared the local healthcare system is at your local government level, at your ward level. This is what is important. And even if we have all the best laboratories in Abuja and Lagos, that will not make our systems better. It is better that we have these centers, detection centers, even at the ward level.
Now, if you were speaking to Nigerians who are still concerned about this COVID-19 generally, with this new variant, are there other things other than, those preventive measures that we had been taught before now? Are there other things that we should be doing as individuals in this country to even prevent, to avoid catching COVID? Because truth is, COVID is not gone from our system anyway. And now we're talking about a new variant. So are there other things apart from, some of those things we've been taught to do to do now to avoid catching the disease? Are there other things that you think as individuals we should be doing?
I think the old system always works. What are the old system, what we are told, is to make sure that we prevent spread. That means your personal hygiene, washing your hand and making sure that whatever you touch, you get your hand washed with soap is very, very important. The use of sanitizers and alcohol, at least 60%, is very, very important. Not spreading aerosols in terms of cough in a motor vehicle or in a public place by covering your mouth, using handkerchiefs or tissue paper, even better, doing that. Wearing face masks is still going to be very, very much applicable. This is one very effective way of doing this. And then physical distancing, if you are in a place where you can do that. And the vigilance, if you get sick, if your temperature is going up and you are coughing and sneezing, it's better to get tested. So the worst that can happen is that they say it's negative, then you're happy. But it's better to get tested than just staying back and being worried about it. And then getting informed, being more like health. I expect the ministry and all the health authorities, both in the private sector and public sector, is to be issuing regular health alerts because these regular health alerts, they are educative. That means they just tell you what to do. And they are also, they arm and strengthen the confidence of the people that somebody is on the watch, which is very, very important to prevent panic. So if these regular health, as far as they do not make it in such a way that it becomes an alarm, but basically to issue this information through the radio, in churches, in public places, these health alerts should go a long way to remind people on what they should be doing. So even if you're in the church and then somebody is sneezing and coughing, you know that you have to stay a distance away. Probably the way you get in contact, you now maybe have to, instead of handshaking, you have to bow to the person as a manner of goodwill. So some of these health alerts will go a long way to alert our people and prevent, most importantly, panic, because panic is one thing that disorganizes the populace and really doesn't do anything to stop it.
Finally, Doc, I just want to ask you this. Is there a chance that those who have been vaccinated for SARS-CoV-2 could be immune from these various variants or the different variants that are coming up after?
That is difficult to say. The conventional wisdom is that there might be some degree of protection. But the truth of the matter is that when these variants come up, they might not have exactly the same antigenic characteristics. And that's why it's called a mutation. That means it has changed its nature. So the vaccination might not work as well. It's possible. And this has to be seen in practice. And it's something doctors will dictate quickly after the infection is now within the country. But at this time now, it's difficult to say.
Dr. Philip Njamanze, Chairman, Chilicon Medical Center, thank you very much for coming on the show, and thank you for your enlightenment.
Thank you for having me.
Appreciate it. Well, that's how much we can take on the program this week. We thank you very much for watching. I'll see you again next week. Bye-bye.